What if your family could cut healthcare costs by tens of thousands of dollars every year without losing the care that you rely on? You've seen the ads, you've heard friends talk about it. It's called a Healthshare. In this case, United Refuah's Healthshare. But what is it really? And could it actually work for you and your family? That's what we're going to get into today. Stick around because every second you listen, you're going to get smarter. And oh, you might just save tens of thousands of dollars. Before we get into it, Rabbi Moishe Katz asked me to read the following disclaimer, compliance purposes. This discussion is for general informational purposes only. It does not constitute legal, medical, insurance, or financial advice. United Refuah Healthshare, which is based in Cleveland, is not insurance. It does not guarantee payment and does not guarantee access to any provider or any particular outcome. All sharing within United Refuah is subject to the program's published sharing guidelines, eligibility criteria, and review processes. Listeners, that's you, should consult with qualified professionals regarding their personal, medical, financial, or legal decisions. Examples discussed in this brilliant episode are for illustration purposes only, and they do not constitute promises or guarantees of future sharing. Enjoy. Rabbi Moishe Katz, I want to tell you a stat. Americans now spend more on healthcare than groceries or housing. True or false?
For most people, that is a true number.
That is very, very scary. That's a lot of money.
It is a lot of money. I'll just give you one baseline case. A woman in Lakewood called me up that she got her renewal quote for her health insurance premium, $48,000 for her family for the year, $13,000 maximum out of pocket. That's $61,000 just on healthcare for the year, assuming that she uses her out-of-pocket expenses.
How many people aren't getting healthcare from work for free? Is that most people?
In our community, I would put it about 50-50 today. I would say that about 50% of our community has some form of offer from their employer for a healthcare insurance plan. I would say about 15% probably have the Medicaid or other good subsidized insurance plan through the healthcare marketplace. Then we have a good 25-35% of people that are paying good money for healthcare.
So employers listening to this conversation, learning more about Healthshares, is this potentially applicable to them?
It's potentially applicable for smaller employees that don't have an ERISA requirement to provide a qualified MEC, minimum essential coverage plan, for their employees. They would have to have less than 50 employees, and they would also have to deal with the religious requirements of a health sharing organization. So there are small businesses that health sharing works very well for. Once you're dealing with a larger business, it becomes much more complicated and much less relevant, especially if there are different religions within the business just because of the federal laws governing health share ministries.
I get that inflation is a reality, but how come I never get an email or a letter from my health insurance company, who should live and be well, about a decrease in the cost of health insurance? It's always going up, and I read a stat that Americans are facing the biggest increase in their health insurance costs in 15 years.
Keep in mind that health insurance costs are 20% administrative, 80% medical expenses. From my understanding, the 80% has to be used entirely for the medical expenses that the policy is covering. So when there's an increase in the cost of the medical care that the policy holders are incurring throughout the year, that is going to result in a significant increase in the policy price for the next year. I can tell you that even though United Refuah has not had to increase our rates since we started in June 2018, offering United Refuah Healthshare to the Jewish community, we definitely are seeing creep up of the medical expenses of the membership, not just on utilization, but on the actual cost for the same services. If a doctor was charging $4,000 for 59400, which basically means the 9 months of maternity, that we could see a $1,000 increase this year on what they expect to get. And that's because their costs of living have gone up as well.
For those that don't know, what is a health share?
So a health share is an infrastructure that the government allows people with shared religious beliefs to come together under the umbrella of their religious beliefs to share in each other's medical expenses and be exempt from any insurance-related requirements. So even when there was a requirement under the Obamacare laws for everyone to have an insurance plan, and even in the states such as New Jersey that require that you have an insurance plan, the government recognizes that there are religions that as part of their beliefs, we share in each other's medical expenses. And when we come together and we establish a platform where we can share directly in each other's medical expenses in a nonprofit organization format, it cuts the cost of the healthcare drastically for our members because we're cutting out the fat of administrative of a for-profit. And also our eyes are on the bottom line of taking care of the health of our members the best possible way at the lowest possible cost. There's no eye on profit. There's no eye on shareholders being happy that we're generating revenue for them. Our eyes are on the mission of our organization, which is to take care of the health of our organization's members while keeping costs as low as possible.
When did United Refuah launch and why?
So in about April of 2017, the founders of United Refuah Healthshare, including Lchaim, Shmuel Hoffman, and others, saw that there was a tremendous need of affordable healthcare within our community. There were people who were being moved from Medicaid qualification, and their only other option was a very expensive health insurance plan. And at the same time, they saw that there were options out there that other religions were using to manage their healthcare expenses at a much lower cost.
Yeah, there's Christian health shares are massive.
Exactly. Now, they saw that that was out there, but it was not available for the Jewish population. And if a Jewish person wanted to join any of those ministries, they had to sign a document that said that they have shared religious beliefs, very strong shared religious beliefs to the other religions. And even though there were some times that they were able to waive some of them, at the end of the day, those beliefs are what allow a person to join those ministries. And they said, there's no reason why we can't bring this to the Jewish community. So they undertook on their own to investigate what the possibilities would be. We first visited some other ministries to see if we could open up a chapter under them with our own people, with our own beliefs. And Baruch Hashem, that did not work out. Fast forward to April of 2018, we announced that Baruch Hashem, we have everything in place.
Mm-hmm.
And we launched membership starting in June 2018, the first 100 members. That was our which is Hashem is telling Klal Yisrael, you followed me in the desert, in the unplanted land. You know, the first core 100 members who took the leap of faith and said, I trust you, let's see if we can make this work.
Were you one of those first
I
100?
was, and Baruch Manis was one of them, the chairman of the board. And I actually saw a claim come in yesterday from member 000, who was our first member.
Wow, wow.
And those people are still with us, many of those initial.
Was that scary?
Group. It was scary. It was very scary because we were going up against all the naysayers who said this will never work in the Jewish community.
Mhm.
You have so many births, Baruch Hashem. You always want the best care. You never take what's the standard and the regular. You want what's good. We don't give
Right.
up, and we try to get the best doctors, best health care. How could such a thing work just because it works in other communities? Why would we think that this would work in our community? So definitely there was a lot of, I don't want to say sleepless nights, but a lot to think about and a lot to daven for, that we should make the right decisions and bring in the right people and have the right guidance. And ultimately we saw the siyata d'shmaya with the growth of the organization since then.
Did you keep your health insurance initially?
For the first few months, I kept my health insurance, and we advise everyone to do that for the first 2 months of membership because we have limited sharing
Uh-huh.
of $25,000.
Uh-huh.
And then some people who are not sure about themselves, like they'll take a high deductible plan
Right.
for like their first year. We've had people do that.
Yeah. We'll
But
get
it's
into
less and less. We'll talk about that.
Yeah, we'll get into
Yeah.
that. What particularly led the founders to launch this? I know there's cost involved, but sometimes people launch something that's close to their heart. Did the founders have a background in the medical space, the insurance space? Was there something specific, or they just saw a problem and they went for it?
So their background was in community. They're all involved in community. We also have on our board an accountant. We have on our board a doctor. We have on our board a lawyer. So they give us the full scope of support from all those angles. But the founding members of the board, they saw from a community level that this was not sustainable. There's no way that we can continue taking care of what's important to us, whether it's the tuition, whether it's being able to make a simcha properly, whether it's just being able to afford normal housing and provide for our families, when the healthcare bill keeps on getting larger and larger and larger with no relief in sight. They said, we have to do something about this. There's no reason why we come together for everything else and we try to put together funding for everything else, and there's very little being done. A Moishe that tries to give a subsidized healthcare plan for their employees, how much can they already give? I spoke to one Rosh HaMoishe, and he said they were giving $10,000 a year for every employee. Every full-time employee was getting a $10,000 credit. Today, that does nothing for them. The $10,000, it's a drop in the bucket of a $30,000, $40,000 plan. So all those people, they're taking the $10,000, doing whatever they can to scramble. Some of them are on United Refuah. Some of them are getting subsidized plans. Some of them have very, very poor plans that do not give them the coverage that they need, do not give them access to the networks of doctors that they need. And that's something that we try to solve with United Refuah, is to keep access open as much as possible and keep costs as low as possible.
How would you describe United Refuah? How does it work? If you had to pitch it in 60 seconds, the mechanics of it, right? Someone is paying anywhere from a couple $100 to families, I think still $500,
499 family of
499.
six.
What does that mean? We've established that health insurance is very expensive. A, is this health insurance? And B, if it's not, what are the mechanics of whatever this is, this vehicle that will provide for a family as it relates to some level of healthcare costs?
Sure. So the 60-second pitch, it's not a pitch, a 60-second explanation is that when a member, let's say, pays $499 a month for their family, that
Mhm.
money goes into their share box. It's their own personal share box where their money that they contributed is kept until it's either needed for their own expenses or to be shared for the expenses of another member. Now, when a member goes to a doctor, either the doctor can send the billing directly to United Refuah if they're willing to do so, or the member can pay at the time of service and submit the billing directly to United Refuah on their own for us to reimburse the member directly to either their by check, or soon we're going to be establishing an ACH direct payment to the members as well. Now, we do not limit members to which doctors they can go to. They have total freedom. Anyone that will either bill us directly or will accept them as a self-pay patient, which basically gives them access to 99.99% of practitioners around the world. That's the short form of what we do. We are not insurance. We do not establish limited networks. We're not bound by limited contracts. We give you the members full flexibility to be a healthcare consumer, and we'll work with you, be as flexible as we can with you to make sure that our members can get whatever healthcare they need at their convenience, and we're going to help them whatever we can.
Okay, so that family signs up $499 a month. 2 weeks later, one of the children falls off his bike, has a broken finger, has to go to the ER.
Yeah.
The billing department comes over to the person. Do you have insurance?
Right.
Their answer is
They're a self-pay patient, or
okay.
they can give their card. Some the hospitals will not bill a Healthshare directly. They'll insist you're not insurance, you're a self-pay patient. If you're a self-pay patient and someone goes to the ER as a self-pay patient, they will not require payment on the time of visit.
Uh-huh.
They'll send a bill usually a couple weeks later. A typical ER visit like what you just described in a normal hospital will be somewhere in the $1,500 range, give or take. They'll get the bill. We'll approve the bill. We'll tell them the amount is correct. It's approved for them to pay. They will pay the $1,500 on their credit card. They will submit it to us on our portal or email it, whatever is more convenient for them. And then we will process the reimbursement directly to them, subject to any member responsibility, which we can get into a little more later. The pre-sharing and co-sharing, similar to deductible and co-insurance.
Will the care from that hospital be any different?
Absolutely not.
Let's say it requires an extensive surgery.
Right. So anytime someone needs something more extensive, for example, someone has a scheduled surgery. We have a member now that has a $170,000 spinal fusion that's scheduled in the next couple of weeks. So that's scheduled, that has to be pre-approved, that has to be paid for in advance. They're not going to do that surgery unless they have the money up front. When you're dealing with something that's scheduled and there's a contract in place, as long as there's an agreement on what the payment terms are going to be, their care is not going to be affected in any way, whether we got a discount or didn't get a discount. Well, I have a member that their, I think, 8-year-old daughter needed open heart surgery in one of the big New York City hospitals. It was a $100,000 surgery. They said, we can give you a self-pay package for $25,000, prepay it, and we'll do the surgery.
Mhm.
The surgeon was not treating that girl any different because it was coming in under a self-pay package.
He doesn't even know, right?
He might know, he might not know, but it doesn't make a difference. I mean, it's most of the cost is the hospital, and it's not going to make a difference one way or the other. And at the same time, we're opening up access to all the doctors that will not bill any insurance. They're cash only, meaning direct pay only. So with an insurance plan, there's zero reimbursement for any of those doctors, especially out of state or out of the country. Someone wants to go get some kind of treatment that's not available in the United States. We're there for them because we don't have any geographic limitations.
What if it's an extensive emergency surgery? So someone's rushed in for that open heart surgery that they need right now. Would the hospital treat that patient the same way, whether or not they have insurance?
So what we've seen in those kind of extensive cases, what usually happens is they reach out to us. Then the hospital will reach out to us,
Mhm.
pre-notify and get pre-approval to continue care. They'll keep on sending us updates about the patient. They'll fax us the medical reports and request additional days, request additional services. And as long as they're getting the approvals that they need, they're fine.
How do you know on your side what to approve and what not?
We've never had a case where we denied a member
Uh-huh.
medically necessary care.
Because you have that with I see these videos where doctors will have to negotiate with insurance companies to say this is medically necessary, and the person on the other side of that call, I think the woman's name is Dr. Potter. Very fascinating to see the conversations, but the person on the other side is almost like programmed to deny or at least try to explain why it's not medically necessary. You're saying that if the doctor feels it's medically necessary, United Refuah.
I'm saying we're looking to make sure that every single one of our members gets the medical care that they need. I'll just share with you a story to your point. A neighbor of mine, their child had a very serious infection in their foot, a cellulitis infection that was spreading, and they were not responding to the antibiotics the hospital was administering. Not a United Refuah member. And finally, they found one of the two last resort antibiotics. Finally, the foot started responding and the infection started reversing. Some kind of swab came back, a culture that told them that there's a different antibiotic, a much cheaper antibiotic, cephalexin, that this should also be responsive to. So the hospital got a message from the insurance company, who was aware that this result came back, that they will no longer approve the last resort antibiotic that was working for the infection. They must stop giving it right away, and they're only allowed to use the cephalexin. Whether it works or not, we can revisit it in a week or whatever the time frame is. I told the father, I said, the kid's life is on the line. He's holding at a last resort antibiotic. The infection is climbing up his leg. And he's in very serious condition. There's no way he can stop taking the one antibiotic that we know for sure is working just because the insurance company says they're not going to pay for it anymore. They had a peer-to-peer call between the insurance doctor and the hospital doctor, and they said there's nothing to talk about. So I told the father, I said, pay for it yourself. He can't stop. Father said the hospital will not give the medication. If he's under this insurance plan, they will not let him buy the medication even. It's not something you can pick up in a pharmacy. It's an IV drug. I said, you have to fight this one to the end. And Baruch Hashem, he found another doctor in the hospital, got another peer-to-peer with the insurance company, and he put the picture out the way it is, that they're going to be liable for it, and they got the approval. When you're dealing with a frum organization, our goal is to keep our members' health the best shape as possible and to deal with any medical condition or injury or illness, Rahman al-Islam, in the best way as possible, to give them the best access to care and not to say no for something that's going to help them with their health care, obviously, as long as it's within the confines of our sharing guidelines and what our program was established for.
I've seen on Twitter X people complaining that because they had insurance, the price for surgery was much higher than if they had no insurance, some sort of cash price within the hospital system. Is that somewhat common that if someone doesn't have insurance and will self pay, the price can be drastically different than someone with insurance?
Absolutely. I have a
Why?
member, and I'll explain to you why. I have a member that was here in New Jersey, not too far from here. They had an infection. They went to the ER. They said they're self-pay patient. They got a bill for $500 self-pay. It was a brand new member. He was scared because he was on the Healthshare. He's like, maybe this is going to become a big issue, and maybe he shouldn't use the Healthshare. He doesn't know if it's going to be a big infection that's going to take time to heal. He said he's going to go and retroactively reinstate his insurance that he had just canceled before he joined United Refuah. He reinstated his insurance. He brought the plan back to the hospital. He said, forget the $500, refund me the $500, put it through my insurance. They put in his insurance information. It raised the bill from $500 self-pay to $20,000 insured price, and he was responsible for $2,000 out of pocket between his deductible and copay. And at that point, there was nothing he could do to reverse that back. Now, your question was, why does it work like that? It's a very complicated question. There are different layers to the answer, but some of them are that every hospital has allocated revenue-wise, meaning self-pay revenue, insurance revenue, and a lot of times the prices that they expect from self-pay patients, because for the most part, self-pay patients are not for-profit companies that are paying for it, that people are paying in huge premiums to cover, they're going to be significantly lower than what a person will pay coming in as a self-pay patient.
I've seen people fighting with hospitals saying, I have insurance, but I want the cash price, please. And they're like, sorry, no, we can't do that.
Can't do that.
Yeah.
You can't do that. And that's what happened with this fellow, that once he was in their system as insured, he couldn't get that cash price anymore.
So he said $4.99 for a family of six. What if someone calls and they have 8 people
It's
in
an
the
extra
family?
$50 a month per each additional family member per month.
Got it. And let's say a single person calls up.
$199 a month.
Okay.
A couple is $349 a month.
Got it. Okay. And the prices have pretty much
They've
stayed
actually
stable.
gone down since we started, believe it or not. We started a family was 519 and went down to 499. We started a single was 219 and went down to 199 a month. We've actually cut our co-sharing, which we can explain a little bit more soon, in half for all membership types since we started, which drastically changed the out of pocket for most people throughout the year.
I'd love to understand or just give people a picture of the mechanics behind the scenes, right? Does United Refuah share publicly how many members it has?
We do share. Yeah, we don't like to ad ki chada, lisbar kein misbar. We don't like to count
Yeah.
numbers in Klal Yisrael. They are 5 digits. Baruch
Okay.
Hashem, our growth last year was 55% approximately
Okay.
year over year. And we hope to be on target for close to that number this year, Mitzvah Hashem.
Does every time you get a new member, does that bring down the costs for everyone? What's the, how do the numbers work?
That's such a good question. Like people tell you, oh, so you're going to get another 1,000 members. So everything's going to be cheaper. Like it's going to be good for everyone. But it
Mhm.
doesn't exactly work like that, because if let's say every 100 members that comes in means another 10 whatever pregnancies, halavai, during the year, and another 50 well visits, that doesn't necessarily bring down the cost. The proportion is pretty much straight across the board the same. There are numbers that we look at to see how it works when you grow. There's a few numbers that are important to us. One is our share box per member. Everyone's share box is combined, which is really the backing that's there to pay for members' medical expenses. It's not our money, it doesn't belong to the organization. It's a restricted asset that can only be used for the medical expenses of the members. Now, if we take that money and we divide the total balance by the number of members that we have, that's an important number to analyze to see how much can really have for every member. And as your membership grows, you can see is that number getting smaller or getting bigger, and that tells you the answer to your question. So definitely, it's not an absolute yes that the more you have, the better it is for everyone, because that's not exactly how the numbers show on real life. But where our goal is to help as many people as we can. That's why we advertise. We advertise not because we're trying to generate revenue. We advertise because our mission is to make sure that anyone that could benefit from the program knows that we're here and we're here to help them and answer their questions and help them see if it's a fit for them. We're not here to make the sale. We're not here to try to get you in to become a member and give up something that's really a better option for you. I would say from the people I speak to personally, probably 40% of them, I'll tell them this is not the right fit for you or not a better fit than what you currently have. 60% probably is better than whatever you have now. But it's not for everyone. And we never try to convince people that this is going to be the best thing for them. Our staff don't get paid for enrolling people. There's no incentive if you get the enrollment. We'll never ask you on the phone, so can I sign you up after we give you information about the
Mm.
program? That's not what we're there for. We're advisors. We're going to answer your questions. We'll help you try to figure out compared to what you have now if it makes sense, if it will work with your medical needs, with the providers that you use, or whatever you have now, or some other option might be better.
I want to take a minute to tell you about Twillory. If you are in the market for new men's clothing that feel good, look good, and actually last, you need to visit the following URL. Ready? Twillory.com/koshermoney. If you're listening right when this episode drops, you're in luck. Go take advantage of their Black Friday and end of year sales. It's going on right now. It's their biggest sale of the year, and you get the best part. What is it? You don't need a code, right? No more promo code. They're just giving it to everyone. If you're listening to this months or even years later, fantastic episode, right? Don't worry. Twillory is always dishing out comfortable deals. So whether it's long and short sleeve shirts, shirts that breathe, suits that stretch, designed with you in mind, Twillory has it all. Head over to twillory.com/koshermoney. Upgrade your look today. Remember, if you're not in the market for new clothing, don't buy it. But if you are and you want clothing that feel good, legit, feel good, it's like it's giving you a hug, that's Twillory. So stop compromising on comfort and durability. The things you might be buying aren't lasting, so you're just spending more and more money. Take it from me, Twillory.com/koshermoney. It's the end of 2025, and so many people are looking for and cashing in on tax deductions. I've told you in the past about something that more and more people are doing. They're switching to a smarter way of giving. One charitable account that tracks every donation and hands you a single, neat tax receipt at the end of the year. Sounds delicious? How does it work? It's called the Donors Fund. You may have seen their print ads or heard about it on the show from many episodes. You create an account in under 60 seconds, and once you're in, every donation you make through the Donors Fund, whether it's online, through the app, with their card, or by check, it's automatically tracked and organized for you. So, at tax time, instead of chasing down 47 or 67 different receipts, you just pull one clear tax deductible statement. It's absolutely free. There are no annual fees, there are no transaction fees, there are no hidden charges, there's no funny business. And the team there is actually kind. They work with you. They're amazing. If you love running around, pulling your hair out, trying to find your donation receipts across dozens of different websites and organizations, the Donors Fund is not for you. If you want everything streamlined in one place, check out the Donors Fund. It's for you. All your donations, one button away. What am I talking about? A robust online platform, super friendly mobile app. It's going to feel like a bank account, but for your charitable giving. You can log in at any time and see exactly where your money has gone, what you gave, when you gave it, and how much you've given this year. There's loads more that they offer. I don't want to overwhelm you. I tend to talk quick, but you're getting this and you're like, I'm actually stimulated. Fine. They also offer checkbooks, debit cards, investment options, legendary customer service, and so much more. And every one of those ways of giving still funnels into that same organized record. So here's what you're going to do. Visit thedonorsfund.org/koshermoney. Links in the show notes. Create your account under 60 seconds. Click around, look at their website, check out their app, learn more about it. There's so much there. I have an account. I also have the app. I'm taking advantage of it. Do the same. Okay? So check it out, thedonorsfund.org/kosher money. One of my favorites are those checkbooks. I keep it in my tefillin bag. They have pre-written amounts. It makes giving accessible, easy every single time. And again, every one of those checks is tracked for you. Let's get back to the episode. There's an incentive, or at least does someone gain as a member if they bring on another member?
There is.
Yeah, what's that?
We do have a bring member program, and actually our strongest source of new members is not from advertising.
I was going to ask. That was one of my questions, I promise.
Yeah, okay.
Okay, so you're mechaben. Okay.
It's not from advertising.
Okay.
The most powerful source of new membership is from bring members, which if you refer another member, you get a $100 gift card when they start their third month. And it's just to incentivize you to talk about it. And like when someone asks about healthcare, to make an effort, just explain to them what it is.
Right.
It's not to try to mislead them, because ultimately, if you're the one that sent them, you want them to be happy. You don't want them coming back to you and saying, oh, you told me.
And that $100 gift card or the ad dollars, that comes from the share box, or that's a separate?
No, that's from the administrative. So there is 20% goes to administrative, 80% becomes restricted for medical expenses.
Got it.
I'll just tell you a short anecdote about what you just said.
Love anecdotes.
Someone called up and said he was talking with some friends, and there was someone at the table that said he has like $10,000 of bills with United Refuah that they didn't pay yet. So I don't know if it's the right thing for you. And he just wanted to know if it's true that we have bills of people that we don't pay. So without getting into the complexities of the Rechilos and Lashon Hara, but L'Tayeles, just, if you're allowed to listen, if you're going to fix up a problem. So I said to this person, when I heard that someone made such a statement, let me reach out to this member and find out what he's talking about, because we don't see anything on our end. So I call him up. I was like, I heard that you have bills that haven't been paid and you're not happy. He's like, yeah, I had bills, but I never sent them in. I'm like, you never sent them in? How are we supposed to know about bills you never sent in? You're right. I never got around to it. So, that's something that we can't control. But for the most part, because a member bringing member is what we call social proof, right? It's real. It's someone who you trust that's telling you, friends and family, this works for me. I had 3 babies on United Refuah. They took care of their child's emergency. They took care of serious business. That's who they trust.
If numbers grew by 55%, does that mean you had to increase staff over the last year?
We increased staff drastically. We also just increased again now towards the end of the year, and we're open for hiring now, another group of new staff. Because we do everything in-house, except for 1 or 2 outside employees. Everything is done by our staff who understand the needs of our community.
And is that remote, or is that in an office?
We have, our headquarters is in Cleveland.
Okay.
That's our main office where almost everything is done. We also have a Lakewood office, and then we have a few remote staff as well in other places. Yeah.
Okay, cool. So employing people along the way. I received over the last 3-4 years many requests to do an episode on this. And one question that kept coming up was, what's the catch? What am I missing? What do you mean? I know it's not health insurance, but come on, $500. What do you answer somebody who says that? And we're going to get into the very micro specifics of different elements and, how this works.
So basically, you're asking me what are the negatives of United for Health Share or any health share?
Yes,
What are the reasons
downsides.
why you should really be careful before you join? The downsides, things you really need to think about.
Yeah.
The number one is the pre-existing condition limitations. If someone who has any type of pre-existing condition should have a good conversation with us first to understand how our sharing will work with whatever condition they have.
I have hip dysplasia and I had called. I don't remember the mechanic. It was a couple of years ago, but I did have a pre-existing condition that I may or may not. I didn't know if I was going to need surgery.
Right.
So I ended up going in another direction. So we can use that as an example.
Right. So when someone calls in and they have a pre-existing condition, most pre-existing conditions fall under the standard guidelines, which is no sharing the first year, $25,000 sharing per pre-existing condition per year for second and third year, and then regular sharing of up to $1 million per incident the fourth year and on.
Is each hip a different incident, or?
Yes.
Oh, okay.
Unless they happen from one injury or
Oh,
something.
okay. Meaning it's pre-existing from birth.
Congenital.
Yeah.
Right. Right. So that's a good question. That's a little bit technical.
Tysus asks that
That's
question.
just a question.
Yeah.
Right. Okay.
Okay, we don't have to go that route, but
Right,
okay,
but
go
that's
ahead.
a good question.
Yeah.
Now, anytime we know that a surgery is on the table, we will not take on that surgery. And that's pretty much across the board. Take care of the surgery and then come and join. We don't want someone coming in with a known expense that's going to cause them to be taking out from the share box more than they're putting in. If someone has a condition that's managed well and there's no known expense that's for sure going to come up in the near future, we can take them in. We're going to look at the condition and say, from what we know today, is this person more likely to be giving or taking? If they're more likely to be taking, then we might make an adjustment in what we're offering them for this pre-existing condition to balance the scale a little bit. It might be a dollar cap. We might tell them, we'll share in this condition up to $25,000 for the duration of your membership instead of per year, second and third year, and unlimited past that point. So it becomes very, very detail oriented once it gets into the pre-existing conditions that don't fall under the standard pre-existing condition limitations. That's the biggest reason why a person should not join a health share is if they have a significant pre-existing condition that's going to be limited and it's something that they know they'll need good care for.
And there's no path to say that person will pay $1,000 a month versus $500.
That's correct, because we're not allowed to rate people the amount that they pay based on their health status.
By law.
By law.
Okay, understood. Okay, so someone has a pre-existing condition, they might fall into that 40% bucket that it's just not the right fit.
Right.
What if one family member has a pre-existing condition? The way health insurance and all of that works, is there a hybrid approach of some sort?
Absolutely. We have a lot of families that do that the whole family will join.
Yeah.
And either they'll put on that family member that has the pre-existing condition with a limited membership with us, meaning we'll have an exclusion for that pre-existing condition, and then they can go and get a high deductible plan or some other plan. Maybe if they're in New York, New Jersey, if it's a child, maybe they can get Jersey Care for a child or Child Health Plus in New York for a child. And that will take care of the condition, but they'll still have all the benefits of having the child or the family member on United Refuah, access to every provider in the world for everything else, and whatever else we have to offer them. So
that health insurance plan that they're getting is just for the child?
Just for the child.
Oh, I didn't know that was
It's an option, yeah.
For a single family. If it's for a spouse also, theoretically,
Same
it can be one.
Yeah, it can buy for an individual. The only time you can't do it is if someone has an employer plan, and that's how they're getting the insurance. Usually the employee has to be on the plan in order to be able to put other family members on the plan,
and
as far as I know.
And to get health insurance for that one person is considerably cheaper than an entire family, right? So if one person in the family has pre-existing conditions, it doesn't mean that Healthshare isn't the right fit and they can save money with that path.
Very good question.
I only ask good questions.
Okay.
I weeded out all the back. A lot of the questions I have, I should be honest, over the years, I had a WhatsApp chat with just myself, and I funneled all of them in there, hoping that we would be able to do this. What are some other downsides to United Refuah, or I should say, health sharing, and who is it not for?
So people who like having a very straightforward, simple pathway. They have a list of doctors that they know they can go to. They know they can swipe their card. They know exactly how much they're going to pay, a specific copay. They know their exact deductible, their exact maximum out of pocket, and they don't want to know anything about sending in paperwork. They don't want to have to ever deal with negotiating with a provider, asking for a self-pay rate, asking for a discount. People like that, health sharing is not for them. Because if you're a member of a health share, again, we're all in this together. We're all healthcare consumers. And with the freedom of being able to use any doctor or any hospital in the world, a person has to understand that they're going to sometimes have to stick their neck out, so to speak, to get good pricing to make things work for them. If they're not willing to get paperwork from the doctor and send it in to us for us to reimburse them, there's no way for us to know that they had that bill. I just had a story yesterday. A member had a hospital bill for $22,000. I apologize if you're watching the episode. I just feel it's important to share. $22,000 bill, and it was for legitimate medically necessary care, no problem. Part of the bill was overpriced. A section of the bill was about $14,000, should have been about $4,000. So we told the member, listen, the $8,000 we're going to send you right away. This extra $14,000, we want you to call back the hospital and try to get them to lower that price to self-pay rate or lower rate, or we can take other approaches to lower that amount. We're not ready to pay that amount yet.
We did an episode called Never Pay Your First Bill. And that's the reason, because there are so many mistakes on bills.
Right. And
coding.
It's opportunities also to lower the bill. It's not just, even if there was no mistake, even if everything's good. And this family went, they were panicking because it was over Yom Tif, and they were afraid maybe they would lose the 10% discount that the hospital gave them. And they right away paid the $22,000. So they came back to us and said, we paid the $22,000, send us the $22,000. So they put us we're sending them the $22,000. But I'm saying that mentality doesn't work well, because you have to be able to work and understand that just going and paying whatever they charge for the service without working it through and making sure that we're all getting the best care, but also at the right price, will not keep the system sustainable at the rates that we want to keep it at. So you have to be ready to be a healthcare consumer, be ready to have a little bit of sweat behind your ears, not in a bad way, but just if someone wants to get their healthcare discounted and wants their healthcare to be affordable for everyone, it's not going to be just swiping the card. Even though with many providers, especially today, we have a preferred provider network where we're adding new providers continuously to this network of our own providers that you can just give your card and all the billing's taken care of directly with us. You pay a small check-in fee and that's it.
What's a card when you say
A
card?
membership card, a health sharing card. Yeah.
Okay. So when you go to a doctor, you hand that.
You can hand them the card if they're willing to bill us, and we can guide you. If someone has specific doctors that they use, we can tell you what our experience is with those doctors, whether the direct bill, whether they want the members to pay a self-pay.
So preferred is based off of the ease of use in using that as a provider, not so much medically approved.
Correct.
Okay.
But they're providers that our members seek care at. They're
right.
Good providers.
So you also have to be organized, right? You can't just go to the doctor and just assume your health insurance company takes care of it, which they tend to do. Here, you have to keep track of where you're going, what you're doing, so that when United Refuah contacts you, you don't say, was I at that doctor 5 months ago?
Right. We try to keep things flowing smooth just from a timeline perspective. Like we expect our members to send in bills within 90 days of date of service, so we don't run into those problems.
Mm-hmm.
And also, once you wait too long, if there's any adjustment that's needed on a bill, they're not interested in talking to you a year later to adjust the bill. So yes, you do need to be organized, but at the same time, it takes 2 minutes to upload a copy of your bill from the doctor, and you shouldn't have to deal with it again. If it's something that's more complicated and needs a case manager involved, so our case managers will work with the member to make sure that all the discounting is done properly before the claim is paid. I have another bill yesterday. It was a $55,000 hospital bill, ICU. The hospital already discounted it to $11,000. Fine. We approved it. We told the member, pay the $11,000. We'll wire you $11,000 minus your responsibility, the pre-share and the co-share. And they're like, no, we don't want to pay yet. We think we can still do better. We think we can do better. So that's up to them. If they think they can do better, let them go and try to negotiate it with the hospital and get it lower. But on our end, that's already an acceptable, very good discount that they got, and it's good to pay. So that member is cost conscious. They know that they have skin in the game also, which is why we have the pre-share and the co-sharing, and so the members feel the savings, right? This 20% that they're going to be responsible for is going to make a big difference if the bill is another $20,000.
When will United Refuah talk to the medical provider on behalf of the patient versus the patient talking to the provider to negotiate or to have a conversation for clarity? Is the onus on the patient to facilitate all of those communications?
So our experience is that for the most part, members are much more successful directly dealing with the doctors.
Hmm.
If a member has a patient who's going to the doctor and he has a relationship that he's the one that's going to be serviced by the doctor, and he says, "What's the best price you can give me for this?" So doctor might say, "Well, is anyone helping you? Anyone not helping you?" And that might make a difference in the price. But if the health share is helping them, it'll be somewhere between insurance and self-pay potentially. But regardless, when they're having that conversation, they'll look at them differently than when we call up. Well, they will look at us much more like an insurer and deal with us with insurance prices, which we do sometimes. Again, one of the big New York hospitals sent us back an explanation telling us that we overpaid a claim once because we told them we're only going to be allowing a certain percentage above Medicare, and they calculated that it was more than that. So they want us to request a refund from them. So we do participate with the providers when necessary, but that's not the goal. The goal is the member should have the relationship, the member should understand the care they're getting, the cost of care that they're getting. And for example, the spinal fusion that I told you, the $170,000. So we're actually trying to facilitate now direct communication with the provider to come up with a case agreement that's more affordable than $170,000. Because once we approve that, that's a big bill to take from all the membership. We allow up to $1 million per incident, but if we can knock that bill down to where it should be around $40,000, $50,000, it's better for everyone.
Are some incidents actually more than $1 million?
We've actually never had anything close, any remotely close to $1 million, even over time, even for a whole family. So b'li ayin hara, we have to keep davening that it should stay that way. As a self-pay patient, again, every dollar goes a lot further. So when we hear about a lung transplant costing $500,000 or $700,000, definitely there are things that are very expensive. I looked at a bill this week. It was a chemotherapy bill for a member, Rahman al-Islan, was about $170,000. But once we reprice it, it goes down to about $25,000. So that's much more manageable, and also in the scope of a $1 million per incident cap, it eats away a lot slower. And obviously, if someone sees over time that they're getting close to $1 million, which is very, very far, they always have that option at different entry points during the year to make other considerations for their healthcare, whether it's open enrollment or something through their business. Again, that's beyond the scope of this conversation, but that option is available to them the same way it would be available to anyone else.
Let's talk about a family of six, the Gold Schwartz family. Everyone's healthy, no pre-existing conditions, Baruch Hashem. They're paying their $4.99 a month. They have their well checkups from time to time, an ear infection, things like that. There will be some medications. What's going to be their out of pocket, generally, roughly, assuming that there are no emergency room visits, no surprises? What's that number?
Maternity, no maternity?
Let's do
Spin both
both.
ways?
Let's do
Okay.
both.
Perfect. So for the well visits, we do allow every member to have a fully paid well visit once a year. For babies up to 2 years old, it goes by the pediatric schedule, which is much more frequently. And those are fully paid up to $350 per visit. There's no member responsibility for those. We also offer women a women's health care visit once a year, also $350.
Does that cover it generally?
Generally, yeah,
Yeah, okay.
for the most part. Yeah, so it might be a few dollars off, but
Okay.
the number is based on what works. We're not trying to have the members
Right.
stuck with the balance.
Understood.
So it used to be 200, and that number went up. So, and then we also give you the $200 towards lab work, which is for wellness lab work. We have a list of the standard labs that are ordered at a well visit. Again, that we pay from the first dollar. So that's not going to touch member responsibility. That's all on the share fund. Once a member has other medical expenses aside for the well visit, that's when they'll start paying towards their pre-share, which is conceptually similar to deductible. The first $1,500 for the family for the year is their own medical expenses on their own that they have to pay. It is not eligible for sharing. They will still send it into United Refuah. We will enter it in the system. They'll still get back the same explanation of sharing to show them how we processed it and how it applied to their share fund. Additional expenses past the $1,500, that's when we begin co-sharing, which means that United Refuah will pay 80% of the expenses, and the member who has the expense will pay 20%. For a family, the co-sharing is on $20,000 of expenses. That means if after the $1,500 that they paid on their own, there were another $20,000 of expenses, they would pay $4,000 and we would pay $16,000.
So out of pocket, that was
55,
$1,500
right?
plus, you said 4,500?
4,000.
4,000. So 5,500.
If they maxed out and they actually had $21,500 of medical expenses aside for their well visit. If they did not, which that's not a regular family, that might happen if there was a maternity,
Yeah.
but that's not the regular case if someone just has a few sick visits, not even an ER visit during the year. So I would expect a regular family to 1,500 is normal, and maybe another few $100s towards their co-sharing. So let's say about $2,000, $2,500 out of pocket aside for the $499 they're paying a month.
Got it. So, but if they pass that, I think it's the
The
20,000.
5,500. So meaning they had 1,500
Yeah,
they paid on
after
their
that
own.
5,500 that they paid off on their own, is that 100%
That's when we
from?
start 100% up to 1 million per incident.
Okay.
And that's after the first 60 days where we have the limited sharing of 25,000 for everything combined. Now, here's a good place to explain that because we let our members use any doctor, any hospital, anywhere in the world, the way that we control costs is by determining what's considered a fair price for the services provided. Now, the way that we determine that is we look at the Medicare fee schedule, which is what Medicare would pay a doctor or hospital for those services, and we add up to 50%. That's what we allow for those services. So, meaning if someone were to use a doctor that charges above 150% of the Medicare rate, it is possible that they will have a responsibility in addition to their pre-share and co-share responsibilities. Now, does that happen often? It happens pretty often. And when it does happen, we do try to make an exception and allow additional funds toward it, even above the 50% above Medicare. We might share 50% of the difference, but that is a place where we speak out that we don't have a maximum out of pocket because the 1,500 plus 4,000 is only true if a person's using doctors or hospitals that bill within the limits of 150% of Medicare, which is a very generous, well accepted limit.
How do you, as a member, how can I best protect myself to make sure, without going overly crazy and becoming an investigator, but how do I protect myself to make sure that I'm not about to take on a service that I can get for cheaper elsewhere, that I'm not going to be, I've already paid, I did the math. I've already paid my $5,500. I'm already giving my close to $12,000 a year, 12 months, or $6,000 a year,
6,000
$6,000 a year for my premium or the monthly payment
contribution.
contribution, right? I knew I was going to get clocked if I said deductible or premium because this is not health insurance.
Right.
What can I do to protect myself?
So we do give our members a membership guide that has a list of common services and what price to expect to pay for those that would be considered fair. And anytime someone has something more significant, we do encourage them and sometimes require them to reach out to pre-notify to have that discussion ahead of time so we can make sure there's not going to be any surprises on the billing side, whether it will be approving more, whether it will be guiding them to a lower cost provider. For example, someone needs an MRI. So they can go into the city, into a hospital and pay $7,000 for the MRI,
Mhm.
or they can go to self-standing MRI center and pay $600-700 for the exact same MRI on the exact same machine. It's a matter of knowledge and a matter of the member understanding their responsibility to do what they can to keep costs low whenever it's medically responsible to do so. Obviously, someone has an emergency, they got to take care of their emergency.
So it's always good to call and get clarity
For anything
before.
that's not in the book.
Yeah.
Right.
Yeah.
And anything that's more expensive does require pre-notification. A lot of more expensive imaging, any surgery even requires pre-notification. And we assign a case manager and they walk through who are you using, what's the quote. We'll look it up in the system. We'll put the approval in. We might request medical records to make sure that it's true medical necessity. It's not an undisclosed pre-existing condition and go from there. It's a very quick process.
Artificial intelligence is everywhere, powering mind-blowing tools, smart systems, and yes, plenty of hype. But here's the real question. How can AI actually help your business? How are your competitors already using it to build smarter apps and streamline operations? That's where bitbean steps in. They take your big ideas and bring them to life, using the latest AI advancements to make custom software more powerful and more affordable. So, whether you need an app, a robust back-end system, or a full-scale digital solution, bitbean can design it, build it, and help it grow. So visit bitbean.com to start the conversation and tell them Ellie from Kosher Money sent you. You'll get premium software without the premium price tag. The link's in the show notes, QR code on the screen. You know what to do. We talk a lot about stability on this show, and right now, we know the headlines concerning Eretz Yisrael, Israel, they shift every single day. But even when the news cycle moves on, the reality on the ground doesn't move on. And for Israel's most vulnerable, the widows, the orphans, the seniors, the need is constant They rely on Colel Chabad, the longest lasting organization in Israel, not just for food, but for steady, dependable security. And that's why I'm asking you to visit kolelchabad.org/kosher money right now. And here's the incredible part. Get this. They're currently in the Impact Now Challenge. What does that mean, right? Like, what? Impact Now Challenge? Thanks to the incredible generosity of Michael and Debbie Flax, there is a massive $3 million gift on the table. That means every single dollar you give is matched, dollar for dollar, to unlock $6 million for Israel's needy. We spoke before about the donorsfund.org. You can even open up their app, look up Kol Chabad, and you can give. And you know, we love maximizing value here. So if you want to double your impact instantly, take advantage during this time-limited opportunity. And if you want to see yourself celebrate this impact in person with everyone else, mark your calendars for Sunday, December 7th, 2025, Yud Zayin Kislev, for the Nashi concert. The lineup's absolutely unbelievable. Ellie Marcus, Shulam Lemmer, Joey Newcomb, my personal fave, Yehuda Green, and Benny Friedman. You can grab those tickets at www.kolchabad.events. Don't miss the event of the year. They waited for the last month of the year to pull this off. Don't forget to book your tickets, get your tickets, whatever verb you want to use. Just make sure you're there. And don't forget to unlock that $6 million to double your gift today at kolchabad.org/kosher money. Kol Chabad, you got to love it. And you can even do that while you're listening to the rest of this amazing episode. Speaking of the amazing episode, let's get back to it now. So monthly, over the course of the year, it's $5,988. Did I do my math? Because you said $499, so minus
right.
12. Okay, so I paid my $5,988 in my monthly contribution. Is that tax deductible?
Not right now. There's actually, from Trump's last presidency, there was a bill in the IRS to make Healthshare contributions tax deductible.
Great again.
Both for individuals and both for a company that wants to pay it on behalf of their employees. It's still sitting there stuck, waiting. It was resurfaced in May, I believe, but it's nothing, no movement of any significance yet. So we are looking forward. Again, the reason is because it's not a true charitable contribution in the sense you are getting something back in return. You're getting the sharing power back. But they wanted to at least be tax deductible as a medical expense, like medical health insurance is tax deductible.
I like this Trump guy. I might vote for him in 2028. So be on the lookout for that.
Okay.
Okay, so we've been through the tax deductible medications. So let's say I went through the course of the year, I paid my close to $6,000 in contributions. For whatever reason, I paid out my $5,500. I'm maxed out. I go to the doctor. I call up Moishe Katz and his amazing team. They say, "Yeah, go. We'll take care of 100% of the
Expenses.
the expenses of your ear infection visit." And now the doctor wants me to go pick up the antibiotic.
Okay.
How do the medications work?
Excellent question. So this is another a little downside of health sharing is that we have limitations on prescription medication. We understand that for the most part, regular prescription medications can be purchased very inexpensively as a self-pay patient. If you have the right discounts, whether it's GoodRx or Needy Meds, any other resource that we can guide our members with, we don't touch those. Those are on the member's responsibility. High dollar drugs, which are the real expensive medications, which we define as any group of medications that will cost the member $10,000 or more over the course of 90 days. Those have full sharing eligibility like every other eligible medical expense, as long as it's not for a pre-existing condition. Other prescription medications, for example, if someone's on a medication that's costing them, let's say $1,000 a month, it's not $10,000 over 3 months, but it's still expensive. Those can be sent in for compassionate sharing request. Those are not standard across the board, and that will depend, obviously, if it was a pre-existing condition, how much it costs, what the duration of time a person needs to use it for, and those we set up on a case-by-case basis. For the most part, we see that the common medications that most of our members need, for example, high blood pressure, cholesterol, the simple antibiotics, the augmentins, the amoxicillins, the clindamycins, those are not expensive as a self-pay patient, and it would not be worth it for our members to include that in the sharing program. If a member has a challenge with a specific prescription medication, we encourage them to reach out to us. So either we can guide them to a resource to get it for less expensive, or we can help share it in the medication under a compassionate basis.
What would you say the average family is spending on just these basic medications over the course of
Not
the year?
more than $200 a year.
Oh, wow.
I would be very surprised. Very surprised. Now, there are some that are more expensive, the behavioral medications, the Adderalls, Those are not simple, and those are not medications that we share in.
Hmm.
And that is a challenge. And sometimes a member that has a child that has to take those medications might consider an insurance plan.
Hmm.
It might be worth it, it might not, because could be the insurance plan will cost more than the actual medication. But there are gaps for certain
Right.
medications. Can't be everything for everyone.
Imagine growth hormones is very
Growth hormones
expensive.
are also right. We share in the testing for the growth hormones, but we don't
Uh-huh.
share in the actual hormones themselves.
So let's go back to the example of the Goldschwartz family, Bishat Taiva. Their fifth child is on the way. What happens to the numbers?
The pre-share and co-sharing stay the same for a family. Again, that's going to be the 1,500 plus the 20% on 20,000 of expenses. An average pregnancy, labor and delivery with the 9 months of maternity, doctor, hospital, labs, ultrasounds, everything together is roughly 7,000 for the doctor and about 15, 18,000 for the hospital, and 1,000, 2,000 more for ancillary charges.
What about the
Epidural?
numbing shot?
Yeah,
Yes.
so that's depending who the provider is. I don't want to call out names, but some of them are very, very expensive. But that ranges between about 1,500 and 10,000.
Okay.
But if we put everything into that picture, they will probably max out for the year their pre-share and co-share, the 1,500 and the 4,000, right? Now, like with insurance, if their pregnancy spans 2 years, it might be split over 2 years. So half of the pregnancy bills might go to 1 year, half of them might go to the other year. So it might show up as 2,000 one year, 2,000 the other year, but it'll be somewhere in that range. Now, with a couple, there is an additional responsibility besides for their reduced pre-share and their reduced co-share. Their pre-share is 1,000 instead of 1,500, and their co-sharing is 20% of 10,000 instead of 20% of 20,000. They have an additional $900 responsibility towards maternity costs to offset maternity costs. Now, if a married woman is on United Refuah as a single member, so she also has a reduced pre-share and co-share like any other single, which is 500 instead of the 1,000 of a couple and 1,500 of a family.
Hmm.
And she has a reduced co-sharing of 20% of 5,000, which is only $1,000. Unlike the 20% of 10,000 for a couple and 20% of 20,000 for a family.
There's going to be a test on this, so everyone should be taking notes.
Important numbers, very
Yeah.
important numbers. So the single member, a married woman who joins as a single member, if she has a pregnancy on United Refuah, there's an additional $2,500 pregnancy responsibility because they're putting in so little.
Hmm.
They're putting in $199 a month, and they're putting a $500 pre-share and maybe $2,000 or $1,000 co-sharing. How much can they already take out just for maternity every other year, whatever it is? B'sha'at taiva, like you said, it wouldn't be fair to just put $25,000 every other year on the system for the $199 a month. So we want them to put in a little bit more, so they put in another $2,500.
Got it. And then once that child is born, they go from 6 to 7. That's an additional $50 a month.
$50, right? Exactly.
Okay, cool. Fine. So I'm getting it. I'm learning more about it, but I will say, and I'll reiterate something you had said, that many a times a friend might tell you something about it, though each case could be very sounding similar, but there could be different
Truly unique,
nuances, right? Right. So we spoke about the well checks, the annual physical. We spoke about the ER, hospital stays included in that, surgeries or expensive treatment. We discussed that as well. Dental and vision. How does that work?
Perfect. So dental and vision is a little bit new to us. We started off without dental and vision sharing. We started with a new program about 2 years ago of $350 dental credits for every member. We increased it about a year ago to $100 dental credits per member. So let's say there's a family of 6. Each one of the 6 family members can send in 3 $100 dental bills every year that will go towards their sharing, which means it will go to their pre-share, go to their co-sharing, wherever they're holding for the year. So again, that's true value. A family of 6, that's $1,800 of eligible expenses, whether it's a cleaning or a cavity or root canal, wisdom teeth, whatever it is, 3 $100 credits. We are considering raising it for 2026. It will be decided by the board of directors shortly, or maybe making it 200s instead of 3 100s. We're seeing that people sometimes have larger bills and they'd rather us share in a $200 bill. They don't necessarily go to the dentist 3 times a year. So we're spinning those numbers to see if that's plausible, and we can make that happen for them. For vision, if someone has a true medical issue with their eyes, that's a regular medical event, and we'll share in that like any other medical expense, 50% above Medicare, pre-share, co-share, $1 million per incident.
Mm-hmm.
Just had a member yesterday, suddenly lost vision in one eye.
Hey.
So, the doctor wants them hospitalized immediately. They had an MRI. They see that it's something very serious going on in their eye. They need intravenous steroids, serious stuff. So that's a regular medical event. Just because it's with the eye, that's not vision restricted, so to speak. The vision allowance that we have, which is $150 refractive visit per year, that's just to check the prescription and make sure that your refractive corrections are where they need to be. It's not for true medical care for the eyes. That's a regular medical event.
To me, any money that goes towards dental vision is a win because many times health insurance isn't,
Right.
almost as if teeth and eyes are not part of the body. They ignore it completely and they don't.
Right. Even when we had insurance, the dental network was so poor, we
Yeah.
weren't interested in using any of the dentists that were in the network.
hmm If there's a doctor listening and wants to become, be added to the preferred provider network, that's just a
Reach out,
contact.
preferred at unitedrefuah.org.
Oh, wow.
Send an email and we'll get back to you.
Someone told me that you guys did an extensive survey of some sort to poll the members. Were there any? Have you done that?
We did one survey for medications.
Okay,
We've done a couple of other micro surveys. The big survey is coming out in the next, I would say, week or so. We commissioned the company to
that's
do a
cool.
very, very, very detailed survey of our members to understand what they like, what they don't like, what's the one thing they would like us to keep, what's the one thing they'd like to see us change,
Uh-huh.
and really hear the voice of our members because that's what we're here for.
Are you excited to get the
Very, very
results?
excited.
How many questions is that survey going to be?
It's about 7, 8 pages. It's
Oh,
a
yeah.
long survey and a lot of breakdown questions.
Hope
We
there's a.
spent a lot of time putting it together.
Is there going to be a gift card for members?
Maybe a raffle
Oh,
or
yeah.
something.
Okay,
Yeah.
good.
Any
Um,
suggestions for prize?
prize, honestly, goes a long way. These Amazon gift cards or just a Visa gift card, let
Oh,
people spend it
the way they want.
however they want. Do people ever gift memberships for other people, or maybe a grandparent would say, "Hey, I want to pay for my entire family," extended family, things like that.
We have parents that pay for their married children.
Uh
That's
huh.
as far as I'm aware of. But
Right.
that's common,
Right. Right.
especially if they're learning in Colel and they're making a few extra dollars and they're not eligible for Medicaid.
Right.
Parents would rather pay the $349 a month for a couple membership.
I was in Lakewood or Tom's River rather, and I had this pinned. I've been meaning to do research, but someone says he runs over to me because I mentioned United Refuah, and I said, by the way, for someone that has no pre-existing conditions, they may want to just take a look at it. I was very clear that this is not health insurance, but this is something that has existed for many years as Healthshare, and there's something called United Refuah. Take a look at it. So then someone ran over to me and he says, "By the way, I have a child who may need some level of services pre-existing," and he told me, and we touched on this, and I want to try to get clarity, probably for selfish reasons, because if I myself have a pre-existing condition, he says that a high deductible insurance plan where he has his health share, right? What type of insurance do you think he or someone in a position where they may have something that in the first year it's pre-existing, they might need a surgery or whatnot? What does that insurance look like? What are the costs associated with it? I think he even said there was a lot of people there, but like he says it could be anywhere from $0 a month with subsidies.
Right, which is a hot topic today because a lot of those are going away
Okay, so but then he said it's to about $0 a month to about $525 a month for a family of four, making around 170,000.
for catastrophic plan,
Yeah, yeah. Meaning,
for a very high deductible
yeah.
plan,
So,
like
but
really poor plan.
right, but for someone that most of us have health insurance
Right.
for the emergencies,
Right.
right? I have a high deductible plan. I think it's like $14,000 a year. Thank God I never really
Gosh.
reach it, but
That's what it's there for.
it's for
Right.
catastrophic. So you say, okay, someone's on United Refuah. What is a very low cost catastrophic plan that if God forbid it's over $1 million or whatever it is, they can sleep better at night?
Or if it's something we're not going to be
Or
able
you're
to
not
share
going to
in, we're
cover.
going to
Yeah.
carve it out for them. So
Because when I mentioned this to my wife was, and I think rightfully scared in the sense that she's never heard this. She says, how can we get rid of our health insurance? And I said to her, I don't know. But if I can come back and say, hey, there is a health share plan. we're not going to get rid of our health insurance. You'll still have some level of plan to keep you comfortable for X amount of time, maybe forever, I don't know, but it's going to be considerably cheaper at the end of 12 months based on what we're paying now. What does that plan look like? What does that mean? Potentially only paying $300 for a high. Walk me through the mechanics
All
of
right, so
what that.
300 is a very low number. He must be a young person, like especially in New Jersey where it's age rated. He's
Uh
probably
huh.
25 years
Okay.
old, I would guess, if he's throwing out a number like that. But let's say we accept a member and
Okay.
we're putting a very low dollar waiver on a condition that they have that might become a serious issue one day. So that if they want to protect themselves properly, they might want to consider having a high deductible plan that has the network of choice where their doctors and their hospital are included in the network. So if they ever need the care that they're worried they might need, it will be covered. Even if there's going to be a significant deductible, they're not going to be left with an astronomical balance. Now, I'm not allowed to give insurance advice.
This is
That's
not advice, everyone.
right. No
Okay,
insurance
good.
advice. But
Yeah.
from practical standpoint, that's what people need to make sure anytime they're looking for insurance is who are the doctors that they need and understand their plan, understand what their out-of-pocket costs are going to be, understand whether they'll need pre-approval if there's a gatekeeper every time they need any significant care, know what you're buying and make sure that it's going to cover the needs, the anticipated needs, and the doomsday needs, chas v'shalom, rahman al things that they're worried about because of their condition that might happen one day. And they want to protect themselves and they know that they have limitations under the health share because we had this conversation ahead of time and we put this limitation in place to protect the sharing group from that conditions, expenses ahead of time with clarity, transparency, integrity.
He says it's a high deductible insurance plan. This one has a $12,000 deductible
Right.
and a $17,000 out of pocket max. Through the marketplace, it can be anywhere from $0 with subsidies to
Right.
about $525 a month for a family of four, making around $170,000. But if he has this plan, wouldn't on the hospital side say, "Hey, you have insurance. We're not going to give you a cash
Self-pay
price."
rates, right? That does backfire, but there's nothing we can do about it. It's okay. Meaning, let's say
Yeah.
someone has that plan alongside United Refuah, which some people have.
Yeah.
Not, I would say less than 2% of our
Okay.
membership. But let's say someone has something like that and they go to the hospital and they have an expensive bill. They have a hernia surgery
Uh-huh.
and it goes towards their deductible and they max out their out of pocket and $17,000. They pay the hospital $17,000. As long as the $17,000 is within what we consider usual and customary for the surgery and the surgery wasn't excluded under United Refuah, we will share towards that deductible that they paid on their own as well. Now, if it's something that we limited and we said we'll never be able to share in that surgery because it's already on the table when they're joining, then that will be their responsibility.
He wrote something United Healthcare or UHCCF. It's a grant that can help cover your deductible up to $5,000 per child. You need to have insurance to qualify. Their site says the income limit is $170,000 for a family of five. Not sure if it's adjusted for larger families, but it's just interesting to
Right.
hear that
Resources.
there are different
Sure.
resources. He told me about, asking for that discount, which I think is important.
Right.
Don't be lured by the 10% discount if you pay that $22,000 without thinking, right?
I just
Um,
had a member not too far from here. He had a
yeah.
$5,000 bill. He was in the emergency room.
Hmm.
And I said, I think you could do better. I was just schmoozing with him about it. He's like, I don't know. I tried. He just sent me a text message. I got it down 90%.
Right.
So I
Right.
owe them 500.
Right. I had that with I returned a leased car and they said, "Oh, there's some scratches here and there. You owe us, 1,700." Inside in the facility, they said, "You know what? We'll make it 1,500." My leasing guy's like, "I'll call." He got it down another. They said you have to if you call within 7 days to pay, we'll lower it by 10%. So my guy says, "Don't worry about that. That's just to get you to pay." The guy calls. He says he got it down 20%. So
Right. A lot of times when we speak to providers and we explain to them that this is a religious sharing group, this is not a for profit, this is money that we're each taking from our own pockets to share towards our members' expenses, they're willing to work with our members and lower the costs. It's not an insurance company that's paying. Even if he's not paying on his own self pay from his own pocket, and we're here to help him, they understand that as well.
I spoke to a friend that when they stopped paying for their health insurance and went to United Refuah, they took the money every month that they've been saving and they put it into an account if God forbid they ever needed it for something medical, that it's there, and it grows, which I like in that whenever someone has found money, it's very easy to spend it or to say, okay, I'm going to level up my
Living.
spends and living, right? It's kind of cool to think that if the right family.
I can afford the new lease now.
Right, right. Go easy on the cars and take that money. You can invest that money. You can, put it towards a chasana. This is real money that don't think just because you're saving that you should start spending, which I thought was pretty smart.
If you go back to that woman that I started off with that
Yeah.
was paying 48,000 under her new renewal, plus that $13,000 maximum out of pocket, she asked me, what do you advise people to do with the money that they save when they come to United Refuah? Because she goes down from 48,000 to 6,000. That's a lot of cash in pocket.
Someone wrote here, a friend wrote 24/7 access to telecare. What's that about?
Telemedicine. Yeah, so we do offer our members 24-hour a day access to a system called Octegrity, which
Hmm.
is board certified physicians. They can diagnose and treat remotely, virtually over phone or video,
Calling prescriptions.
calling prescriptions
Oh, wow.
24 hours a day. And that's for ages 2 and up. And there's no charge for our members to use that system. It's fully shared.
Do people call for recommendations on specific doctors? I know you have a preferred network, but if there's a specialty, everyone has someone in their community that they call as it relates to that. Do you get a lot? Do you field a lot of that?
We not a lot of it, but when there is a significant case, sometimes they'll pass by us the different options that they were given and ask us who we recommend. We try to leave that for those who specialize in the referrals, but it does sometimes cross our desk that we have to get a little bit involved in that.
What's the short answer on a CPAP machine? Where does that fall into? Which bucket is that?
That falls under durable medical equipment for a non-acute injury or illness, which is not eligible for sharing, but we will share in a sleep study for our members.
Okay, cool.
But
Which
not for
I
an actual
highly
machine.
recommend. I've had a CPAP for 5 years. I should probably lose weight, but without even sleep apnea, the doctor said I'm getting you one, and it's been an amazing
Life-changing.
journey. Oh my goodness! Someone told me they sleep with a mouth guard that is probably a whole lot more convenient and it works. But to each their own. I even had a contact. I should tell you this. I posted on my status. Probably sent it to about 12 to 16 people. Someone who comes to your house that came very recommended and will try on different masks for you until you find the right one that's comfortable, because so many people get CPAPs and it just sits on the floor because they didn't get comfortable with it. Having the right mask is important. Those who want that contact should reach out. So what didn't we cover? There's so many questions here, but I think you did a good job covering a lot. What didn't we cover about United Refuah that I should have asked you? And also, now that you've been at this for 7, 8 years, how does United Refuah differ than other health shares, or is it just the same playbook? Every health share does the same thing, and how does that work?
Okay, so I'll answer your second question first. It's
Yeah.
a simpler question. The second question of how we compare to other health shares, again, because it's very religious specific. If you're a legitimate health share, there's 5 requirements by law that you have to have. And one of them is the shared religious beliefs. So it's not apples to apples for the most part, but if you want to know like cost comparison, we really try to create our model very, very convenient and very affordable and very specific for the Jewish community. For example, one of the other big non-Jewish secular health shares that are not legal, so to speak, they're not authorized in all states because they don't conform with the legal criteria of a health share, but they created like a pre-share for every single expense. Instead of having a family pre-share for the whole year, every expense has the first unshared amount. Another one, any bill under $200, they don't touch. So things like that will not go well with our people. Like everything, we want to feel that we're in this together. As soon as there is any significant expense, we're all helping each other out. So we tailored the plan, the membership for our community. So it's not something we can compare and say, what's the competition like? The competition is very different. Again, it's very religiously nothing to do with our religion. For someone to go and join a religious health share of another religion means that they're signing a document that says they have very strong religious beliefs of those religions, as opposed to when you join United Refuah, you sign that you believe in the Yud Gimel Animamins, the 13 principles of faith. Now, cost-wise, meaning that our model is probably the most affordable if you were to compare to other health shares from the ones that we've looked into, even put religious aspect aside, just because of the way that it was set up for the Frum family to work well. Your first question is, what did we leave out? I can't emphasize enough that we want our members to feel when they join United Refuah that we're in this together. In order for this to work, we all have to be invested in it working. It's not what can I get out of the system. It's what can I do to make the system work, that this should be good for all of us. When someone's coming and saying, what can I take? What can I take? What can I take? It will not work. You won't be happy, and it will undermine the integrity of the whole system. When a member is invested and they understand that when Klal Yisrael comes together to help each other, we have a tremendous power, we have a siyata d'shmaya, then we see that bracha, we see the blessing in what we do, and we see that it works. Bli ayin hara, I don't know any other product or service anywhere that hasn't raised the price in 7 years. I can't think of anything, and it's not something I can take credit for or anyone in our office can take credit for. It's siyata d'shmaya, and obviously the prudent work of our members making sure that they're being responsible and they feel the responsibility that they're using other people's money whenever they spend on their healthcare. So they're not denying themselves healthcare that they need, but they're being responsible about their spending and making sure the pricing is good and they're making good choices.
You ever educate your members on the importance of an annual physical, like almost like an email drip campaign of things that are important? Don't forget about life insurance, or you have many contacts that look to you for
Health guidance.
health
Right.
guidance. There's a real opportunity
Right.
to almost create an online community of education.
Right. So we don't have a blog, but we do have a monthly newsletter that we send out to our members, and it's a mix of some kind of Dvar Torah, something that a message on the time of year,
Hmm.
and we'll also put in throughout the year different health messages when we introduce sharing for preventative care,
Hmm.
for colonoscopies, for mammograms, first dollar sharing. Again, that's not subject to pre-share or
Right.
co-share. We have a $1,500 limit for colonoscopies after your first year of membership. Mammograms, we also have a very generous $300 limit every other year, not subject to pre-share or co-share. To other preventative services as well. So we'll elaborate on those. We can't push people to do it, but
Yeah.
definitely we see the importance, and we talk about the physicals, why we're paying the
Right.
$350 for the well visit. It's important, and definitely the decision is yours whether to go or not. And we do see a very large percentage of our members taking advantage of that availability. But the education is very important.
I'm putting my marketing cap on. In that newsletter, you put on a WhatsApp status for people to copy and just upload to their status that says, reminder, go for your
Physical.
annual physical. Yeah. The reach there is great. I should have asked these earlier because there were so many micro questions.
Sure.
Someone asked, if you're not regulated like a traditional insurance, how do third party audits work or reviews to make sure that everything on the back end is A plus
Kosher.
kosher? Yeah.
Right. There are 5 requirements, like we mentioned, by federal law in order to qualify as a healthcare sharing ministry. You have to have been in existence since December 1999 or be a successor of such an organization. You have to be a nonprofit organization. You can only accept members with the same religious beliefs. You cannot terminate a member because they develop a certain medical condition that you don't want to take care of them. And you must have an annual external audit by a CPA who's qualified to perform an external audit. They're actually in our office yesterday doing the first part of the 2025 audit.
And is one of the things they're looking for financial stability?
That's what it is. It's
Right.
it's all financial and checks and balances, internal controls, and they put out the report at the end of every year. It's available upon request, and it shows all the ins, all the outs, medical expenses, claims payout ratios, any findings that they have. And Baruch Hashem, it's been a very, very, very good process working with them. It helps us appreciate the integrity of the system, the integrity of being able to help, and the blessing in the numbers that we're able to keep the prices low for Klal Yisrael.
Wonderful. I would imagine you get phone calls sometimes during the night, right? Someone's in the hospital, they have a question, you know, emergencies happen on Shabbos, uncertainties. Are the phones sometimes ringing off the hook? Is it easy to communicate, get in touch? Someone is there? Because many times there could be emergencies.
Sure. So we have our regular business hours, Monday through Thursday, 9 to 5, Friday, 9 to 12 or 1, depending on time of year. And then we have after hours service where there's an answering service that fields a call, collects information, member information, and will ask, is this call urgent? If the person says yes, they will transfer it to someone who can help them after hours. Now we have to be careful because that does sometimes get abused. I'm saying we got a phone call, someone
Mm.
called in as under the urgent line.
Hmm.
They wanted to change their payment method. They wanted to make sure that it wasn't going to be charged under their old payment method for the next month.
They listened to kosher money, and we said stop using credit cards.
This
Should be
happened
debit cards.
yesterday.
Oh, okay.
And another emergency that came through yesterday was someone in the ER, but they told the answering service, it's not an emergency. We're just letting them know that we're there. We're fine. They're in the emergency room. They don't need our help. If someone has an emergency, they know they're supposed to go to the emergency room. They don't
Right.
need to come to us for pre-approval before they go to the emergency room. So it's more when someone has any type of question, what should they do? How should they deal with it? But they don't need our permission to go to the emergency room. So the need for someone after hours is more to be comforting to our members as opposed to being a necessity to persons to be able to get the care that they need.
Got it. What's the best email address for someone who's listening and says, I have a list of 11 questions I just want to get clarity on?
info@unitedrefuah.org. REFUAH.org.
And we'll put a link on the email address in the show notes. I imagine also the website has quite a bit of information.
Yes, unitedrefuah.org. Again, unitedrefuah.org. You can set up one-on-one with an advisor, talk about the program, answer all your questions at a scheduled time that's convenient for you on our website. There are also some informative videos that you can watch to give you a good overview. I can't imagine you learn anything that we didn't touch on here, but
Right.
it's always good to have that quick review.
You grew up in Cleveland?
Toronto.
Toronto?
Yeah.
Oh, wow. I love Toronto. I go to H3 there, and I'm hopefully going to be at H3 in Cleveland.
Right.
When you were growing up, did you always say, I wanted to be the CEO of a Healthshare company?
No.
No. What do
Not
you want to do?
specifically. Help Colel Yisrael.
Okay.
That's what I saw
Yeah.
in my family, was helping Colel Yisrael was what's important.
What type of family?
Board of directors in the schools,
Yeah.
chesed, caring for people, looking out for people who are unseen by others.
Right.
That's what we grew up with.
It's amazing how Colel Yisrael has so many organizations dedicated to very even niche
Right?
people, right?
Right? Right? And you don't want anyone falling through the cracks.
No.
And this is a huge segment, though. This is like, we estimate that we've saved Colel Yisrael about $160 million in healthcare costs since we started. If we look at how much people have paid in for health sharing contributions, and we compare that with the average cost that they would pay based on single couple and family and our membership size at different periods, we estimate somewhere around $160 million of healthcare savings.
Wow.
Now, just to put that into perspective, it's about 16,000 takana chasanas.
I always say if an episode helps just one person live a better life, save money, take care of their family, it was worth it. And I'm optimistic that hopefully many people become aware if they're not. And if it is the right
If
fit,
it's the right fit.
then kol hakavod, hopefully they can put that money towards a beautiful chasna, buy an apartment for their children, or just
Go into debt,
not
be
go
able
into
to
debt.
finish
Right.
the month. Yeah, that's for many people. That's what it's all about. It's not about extra money. It's about being able to afford the necessities.
Oh my gosh, every time the health insurance comes out of the bank account, it's like, ooh, yeah, it's a lot.
So you're reminding me about a call I had once with a member. He was upset that he was finishing the year and he didn't get anything out of it. He put in every month $4.99 and he didn't submit any bills. And I had to change his mindset. I'm like, Baruch Hashem, you had no bills to submit. What do you mean you didn't get anything out of it? Your $4.99 went to help other families that did have medical expenses, and you were spared those medical expenses. And that's one of the big, beautiful things of United Refuah, is that even if someone does not have any medical expenses on their own, the money that they're putting in every month goes to help another person in the community with their medical expenses. So I can look in my own share box on the inside, on the back end, and I can see $6,000 went out of my share box to pay for another member's expense. And I go and look what that bill is. It was someone had a baby, and my money was used to pay for that person's labor and delivery charges. It's such a beautiful thing. Instead of going, like you said, a premium into no man's land, here the money that's not needed for a person's own medical expenses is still going to help other people in the community.
Ask your Rav if that can be nicer.
Exactly. Yes,
Yeah.
we have heard.
It's a good question.
We have heard different things about that. So
Very interesting.
ask your Rav.
And it's not 6,000. He's overpricing it. It's $5,988, $499 times 12 over the course of the year. I think that's correct. But Reb Moishe, thank you so much for coming down and sharing such great information.
Thank you for having me. I look forward to seeing you again.
Mirz Hashem.
Hatzlacha.
Before you go, I want to share some more things that I learned about United Refuah while I was doing more research. I was speaking to a lot of people, and then I'm going to share a gift card winner. I'm also going to share with you, as we go through this outro, some bonus organizations that you should know about because, hey, that's what we do here. We help people. Okay. Like I said, this was not a paid advertisement. This was a solution that I've seen people using. So I want to make sure that other people know about it. People have a lot of questions. So Here's some more information that I learned. When we first started this conversation, the goal wasn't to convince anyone of anything. It was simply to understand why so many families, especially within the Jewish community, are choosing something different when it comes to healthcare, right? And the more we listened, the clearer it became that United Refuah isn't just about cutting costs, it's about people, real people. It's about having a community that really believes in helping one another, which I think came out during this conversation, and being able to pick up the phone and talk to someone who actually cares. One listener said it so simply. Here's what he said: when I have an issue, I can call and talk to a normal person, someone who understands what I'm saying and wants to help. And that alone says so much. Because in a world where so many of us spend hours fighting through automated menus and call centers, they're always updating those menus, by the way. That kind of human connection from United Refuah, it's rare and it's powerful. Another listener shared her story. Her husband needed an allergy shot that cost $1,000 per dose. That's a lot of money. She called United Refuah, explained the situation, and they helped her figure out a solution she never would have found on her own. Years later, she still hasn't had to pay for a single dose out of pocket. That's what you get with a close knit community. And then there was something Moishe Katz shared with me that stayed with me. He shared it off camera after we finished recording. He said there was a member who had just finished successful cancer treatment. And that person called Ramesh Katz to say, at no point did I ever feel that my health wasn't the number one priority. And hearing that from somebody who's been through something so serious, it hits you because that's the heart of it, Ramesh Katz says. That's what this is all about: people coming together to help each other. There were also a few things we didn't have time to cover in the main episode, and they're important, so I want to share them with you here. United Refuah shares far more than most people realize. Everything from routine care, maternity, imaging, lab work, to surgeries, and even medically necessary high dollar medications. But what many people don't know is that they also share in therapy, and that's huge. Whether it's physical therapy, occupational therapy, speech therapy, mental health, every member gets up to 12 combined sessions a year for the basic therapies and another 12 visits for mental health therapy. So up to $125 each. If a member is recovering from an injury or an illness, they may even be able to extend that allowance. They also include chiropractic care, which you get 12 visits a year, up to $75 each for musculoskeletal issues. And of course, the question if everyone eventually asks, I spoke to somebody, she's been on it for years. The question she always gets is, what if something really serious happens? Right? It's a good question, and I hear why many people ask it. But the answer is straightforward. High dollar, eligible expenses are shared the same way as everything else. You pay your pre share first, then the membership shares 80/20, and once you hit your annual 20% co share max, they share 100% of eligible expenses up to $1 million for each incident. And when the bills are very high, many times United Refuah will work directly with the doctor or hospital to wire the payment so you don't have to front the money yourself, or they can expedite the sharing request to reimburse the member directly within a day or two. That's awesome. But let's be honest, dealing with hospitals and billing departments can be messy. One listener I spoke to talked about the frustration of being told one price in the ER, then finding out billing had no idea what the number even meant. That can be hard, stressful. Or Amish pointed out that United Refuah helps with that too. They'll check if they've worked with a provider before or coach you through what to say to a new one to make sure you are as informed as possible. And sometimes it's as simple as knowing your options, like the member who got a $1,200 quote at one hospital and only $180 for the exact same visit somewhere else. That's a lot of money. There are also a couple of questions people ask online that we didn't touch on, but I wanted to share here because I saw those questions popping up and you might have that question too. And I hope we got to as many as we could, but I'm sure we didn't get to everything. So be sure to email them and ask them or call them. The first question that I saw is a phrase that everyone hears. It's not insurance. But what does that actually mean? United Refuah operates under the Affordable Care Act's Healthshare exemption. It's a nonprofit, faith based health share. It's not a for profit insurance company. So members voluntarily share medical costs instead of paying premiums into a system built on profit. We all know about that. By law, on an organizational level, they are not allowed to promise to pay, as the funds that are used to pay for medical expenses are the members' shared funds, not the organization's funds. But the record speaks for itself. United Refuah members have submitted over, get this, 330,000 sharing requests which were processed sometimes as quick as same day with not a single case ever ending up in Besdin or court. Wow. Let me see that again. 330,000 requests that have been fulfilled and processed. Holy smokes, that's a lot. Okay. And the fact that it hasn't ended up in Besdin or court is very telling. So this altruistic model helps Klal Yisrael. It keeps the costs so much lower than they would be elsewhere. The second question, and that's my personal opinion, the second question is about compliance and taxes. People ask, can I use an HSA? What about state requirements? So I'll tell you, there's no federal penalty for using a health share instead of insurance. In states like New Jersey, United Refuah qualifies under the health share exemption. You can't use your HSA to pay the monthly contribution directly, but you should be able to use it for your out-of-pocket medical expenses while you're a member if you already have funds in an HSA. By the way, there is a proposed federal bill to make healthshare contributions tax deductible, which hopefully will get passed one day. Ohio, I heard, just passed one last week to make it tax deductible on a state level. And for those who split their time between countries, yes, United Refuah shares worldwide at the same rates as in the US, as long as you spend at least half the year in the United States. As you sign up, read their FAQ, make sure that you could sign up with United Refuah depending on which state that you live in. Really cool stuff. It's remarkable to think that such a large portion of the Jewish community could benefit from exploring a health share. It's not for everyone. We spoke about that many times throughout this episode. Like for me, I don't think I can do it right now because of pre-existing conditions, but God willing, one day. It's a blessing to know that so many families can save money. I really wanted to do this episode for a long time, and I'm happy we did it. I hope it helps you at least get the answers you're looking for, share it with a friend, and hopefully everyone can live with greater peace of mind, knowing and using an option like this. Thank you to our sponsors. We have such great sponsors, thedonorsfund.org/kosher money. Sign up for a free account, fill out the form. If it looks good, take advantage of it. I'm really happy to be sharing the Donors Fund with you. Twillory.com/kosher money. Check out their end of year sales, their bonus deals, their bundle deals, everything that you can imagine. I saw a Bekasha. You know that they have a Bekasha now? That's one of those long coats that Hasidim wear. Who else can I tell you about? Chabad.org. They have that Nafshi concert coming up. They have the Impact Now Challenge where funds that are donated are doubled. So thank you to the generous supporters of that. And last but not least, bitbean. If you're looking for a custom software solution for your company, stop spending money you don't need to. You can automate things. You can create processes and dashboards and tools and apps. And with AI, things are so much more affordable. So have a conversation with them. Say, this is how my company runs. What can you do for me? It's a free conversation. You might be blown away by just how awesome they are, what they can create, and the costs involved are probably not as much as you think. So pretty cool. I'm really happy we were able to send so many awesome organizations their way that are extremely happy. Thank you to our friends at Living Smarter Jewish. If you need a free financial coach, take advantage. livingsmarterjewish.org. Set up a session. You can learn how to budget. There's so much you can do. They even have a high school curriculum. So you have a textbook. You can reach out to them, get it into your kid's school or your own school. There's a lot of high schoolers listening to these episodes. If you have debt and you need help, then I have a great website for you, kosherdebthelp.com. kosherdebthelp.com. They're awesome. They even called me. They said, can we use the word kosher? We know we got some trademarks going on, but we told them no problem. We took a look at what they're doing, really excited, really happy that so many people are getting help with their resources. kosherdebthelp.com. It's a project of collectivekindness.net. You can look them up as well and try to support all these organizations. Kol Chabad, Living Smarter Jewish, Collective Kindness, Kosher Debt Help. A lot of people are giving money to this if there's no place of giving. That helps a lot of people in need. So tremendous help can be given by the people listening. We also covered it with Rabbi Shais Taub, I think, right? It's important to know that if you have $100 to give away every year, you should know how to give it. The Shulchan Aruch, it's listed out the proper order in how you give things. Look it up, speak to your Rav. Family comes first, people within your community. You should have a system instead of just giving nilly-dilly, willy-nilly, dilly-willy. Congrats to our new $100 Amazon gift card winner. You want to know who it is? It's Stewart_Little_96. He left a comment on the previous episode with Rabbi Shais Taub, and he says, Rabbi Shais Taub has been a tremendous conduit for Hashem's will and thought in my life. That episode has over 90,000 views. Yaakov's video with the Amish girl who became Jewish has nearing 200,000 views. I'm so excited to see that more and more people are taking advantage of this quality content. And if you want to be entered for the chance to win a $100 gift card, I have a surprise for you. Leave a comment on this video. I'm not even going to give you a specific word. Write whatever you want. Don't write the words whatever you want. Make it a question about the episode. Oh, by the way, I have a band on my wrist. Yaakov Langer had a baby boy yesterday. Isn't that nice? You're probably watching this 15 years from now and be like, oh, Yaakov, I remember you when you had the boy. He's so big now. But yes, Mazel Tov to Yaakov and the entire team. If you want to wish him a special Mazel Tov, email him hi@livinglchaim.com. If you have a guest suggestion, this is a total ADD outro. There's no script, so I'm just going. If you have a guest suggestion, go to the website, click on suggestion, I think, and leave a request there. You can also inquire about sponsorship opportunities. The team wants me to tell you that I also have a digital marketing agency called harvestingmedia.com. We're up to some really awesome things. The team's getting bigger. I think we're about 8 people now. If you want to sponsor Living Lchaim, you can do that as well, livinglchaim.com. There's so much I could say, but there's so little time. So go do something productive. I'll see you next time.
Living Lchaim.